Here we go talk about the care of the client with HIV and AIDS. Here we explain the HIV patient and nursing care. If your patient is HIV positive, we have a nursing care plan. The goal for the patient with HIV AIDS may include like achievement and maintaining the skin integrity and check their bowel pattern, and also we try to prevent or absence of infection, improve the activity, intolerance, and also improve the thought process. Before to go more, I want to tell you what is HIV. HIV stands for Human Immunodeficiency Virus. HIV is a retrovirus that target the CD4 lymphocyte, and CD4 lymphocyte is a T cell or T lymphocyte, and resulting in the decrease the immune function and susceptibility to infection, and we called AIDS patient. What are the risk factors, or what are the underlying causes? The risk factor of HIV: unprotected sex, multiple sex partner, or perinatal exposure. What does it mean? Perinatal exposure means all pregnant women should be tested. If mother is infected, baby have a chance to be positive. It is called perinatal exposure. Or if the patient is HIV drug use, even healthcare worker under the high risk. Let me read it. HIV is a retrovirus that is integrated itself into the genetic materials of the cell and change the DNA. Primary host cell is the CD4 lymphocyte. It is T cell. Decrease the immune system is evidenced by decrease the CD4 count. The viral load test and CD4 count are done every 3 to 4 months. So when a patient present with the symptom of HIV, at the beginning, it is flu-like symptom, weakness, night sweat, headache, or weight loss. Even patient develop the skin rash. How we diagnose the patient? Before to go there, let me read it. The viral load test, or we do the ELISA test, or we do the Western blot test. Viral load test measure the amount of HIV virus in the blood, low 40 to 500 copies per ml, and high when 5,000 to 10,000 copies per ml. If patient is untreated or uncontrolled, 1 million or more copies be positive, be present in blood. The healthcare provider or physician begins the medication when CD4 is at least 250 or less. Disease classified as a HIV when CD cell goes below 200 and patient develop opportunistic infection is occur. ELISA test is done first. Positive ELISA test and confirmed with Western blot test. Confirm Western blot. PCR, polymerase chain reaction test, also done. And PCR can be done to test the viral load. Method to prevent the infection: hand washing, avoid crowded, neutropenic precursor, and so pancytopenic occur. Means all cell go down, WB should go down, leukopenia, thrombocyte go down, thrombocytopenia, and also red blood cell go down. So when all cell go down, we call pancytopenia. When neutrophil go down, patient easily catch up infection and patient come to you with flu-like symptom, fever, high body temperature. So patient education or teaching is very important, right? So medication here, HIV or AIDS medication, usually 3 to 4 antiviral medication we give them, right? Besides the start the medication, we also educate our patient. We called nursing, patient teaching. So we practice the good hand hygiene is super important, and every day take bath with antimicrobial soap. Avoid the raw foods. Do not clean cat or little boxes. If anybody have a habit, avoid the sick people or practice the safe sex. Also ongoing monitoring CD4 cell count. It is very important. And also the nutrition. Here I'm going to explain some medication what we use for the patient. Easy way to remember: HEART. HEART stand for highly active antiretroviral treatments. HIV is a RNA virus, so and decrease the amount of active virus in bloodstream. So what are the drugs name we use? One is called non-nucleotide reverse transcriptase inhibitor. In this picture, we can see the HIV virus structure. Outer layer is called capsid, and HIV, as I told you, it is the RNA virus. So some of the HIV medication stop the RNA replication or inhibit the enzyme that is necessary to formation the RNA. One is called nucleotide reverse transcriptase inhibitor. They stop the HIV production and prevent the conversion of RNA to DNA. So what are the drugs name? We use the nevirapine, or we use sastibha, or we use the etravirine. So most of the HIV or AIDS medication, many of them end in VIR, vir. So when we prescribe this medication, we could monitor complete blood count, CBC, or blood chemistry. We should check the renal function test, serum creatinine and BUN level, or hepatic enzyme, because they can cause renal toxicity or hepatic toxicity. Most of the drugs can cause dizziness, so it is good to take at night. Nucleotide reverse transcriptase inhibitor. Other groups, they inhibit the DNA synthesis. Most common is called AZT or zidovudine or limivudine, CTC, or DDC, gelcitabine, or D4T, stabudine, right? So zidovudine, if you prescribe, we could monitor the complete blood count, CBC, to check the neutrophil or other cell. If you prescribe the limivudine, we need better to tell your patient to avoid the fatty food. If your patient take the DDC or gelcitabine, gelcitabine can cause hepatotoxicity. So liver function test is important. What else? D4T or stabudine can cause peripheral neuropathy, right? Also, BDX or didanosine can cause pancreatitis, means inflammation of pancreas, hepatotoxic, and it is good to give on empty stomach, and they can cause liver damage. Other medication, it is protease inhibitor. So these groups of drugs inhibit the enzyme, protease enzyme, and prevent the infection of the new CD4 cell. The most common one we use in Virades 500, but they elevated the liver enzyme, they can cause hyperglycemia. So must patient need to take insulin, or if patient is diabetic, need to adjust the insulin doses. And also it is good to give with food. Another most common drug we use is called indinavir. Indinavir, it is good to take on empty stomach, and they causes the nephrolithiasis. They lead to stone formation in the kidney and also hyperbilirubinemia. If your patient take indinavir, tell them to avoid the grapefruit juice. Other drugs we use, the combination of two drugs, it is called lopinavir and ritonavir together, Kaletra. They can cause nausea, vomiting, diarrhea, and we need to check the liver function test. The most popular drugs we use right now, it is easy to use. So take once daily on empty stomach. So multi-drugs combination, 3 drugs together, and it's called a tripla. A tripla combination of Sastiva, tonobovir, or emtricitabine. So this is easy to take because take once daily on empty stomach. So Atriplia contain one non-nucleotide reverse transcriptase inhibitor, shortly called NNRTI, and two nucleotide reverse transcriptase inhibitor, shortly called NRTIS. So what else? The other management of the patient, diet for HIV and AIDS patient. Very important for NCLEX board. Give them high protein, high calories, and liquid before food, before meal is good for them. And also decrease the residue or indisciplinary approach needed for them, like supporting group. So what are the opportunistic infection commonly catch up them? Most common bacterial infection, especially Mycobacterium complex, maybe pneumonia, fungal infection, Candida albicans, yeast overgrowth, oral thrush, or yeast vaginitis in case of female, and treatment is antifungal fluconazole. Protozoal infection is most common, especially pneumocystis canerini, it's organism name, or Toxoplasma gondii, toxoplasmosis, treated with infected cat feces, eat raw or undercooked meat, or cryptosporidiosis, oral fecal spread through the contaminated water. So definitely we give them antibiotics, antiprotozoal, or supportive treatments. The last stage, I mean, when patient is developed stage 3 HIV, because stage 3 HIV infection we called AIDS, acquired immunodeficiency syndrome, when the CD4 cell count less than 200 and patient develop so many complications, particularly malignancies like Kaposi sarcoma, tuberculosis, pneumonia, or wasting syndrome, candida of the airway, herpes infection, or other infection. In this picture, you can see different cancer because of HIV patient, right? So the first picture, HIV associated skin disease. Second picture here, Kaposi sarcoma because of HIV. And last picture here, we can see non-Hodgkin lymphoma, right? So malignancy have been detected approximately 40% of all patients with acquired immunodeficiency syndrome. The Kaposi sarcoma, this picture, this has been the most common tumor associated with HIV infection, but it currently developed in fewer other diseases as well. And non-Hodgkin lymphoma, the incidence of non-Hodgkin lymphoma is 60 times higher in individual with HIV infection. Before to finish, I want to recap one point what NCLEX board frequently asks about the nutrition. What food you give your patient, right? In case of HIV or AIDS, give them small, frequent, high protein and high calorie and nutrient dense meal or food, because patient HIV associated wasting is important. They lose the weight loss of 10% and one of the following for 3 days. Patient develop diarrhea, fever, chronic weakness. Because of this, they need consume small, frequent, high protein and high calorie, nutrient dense food or meal.